Subchorionic hematoma. What is it? A subchorionic hematoma is bleeding or the buildup of blood between the wall of the uterus and the sacral membranes which protect the developing fetus, or later in pregnancy, underneath the placenta itself. Symptoms and diagnosis. Vaginal bleeding is a common symptom in the first trimester. Subchorionic hematoma is the most common cause of this. The bleeding can be anything from spotting to heavy bleeding with clots. There is not normally any pain, but some will experience mild cramping. If you have any bleeding in early pregnancy, you will be offered an ultrasound scan, which will reveal the subchorionic hematoma if it is present. Occasionally the subchorionic hematoma cannot be seen on scan. Sometimes patients have no symptoms, and it is an incidental finding on ultrasound scan. What is the cause then? The cause is unclear. Partial separation of the membranes around the fetus away from the wall of the uterus is thought to be the cause. Risk factors for subchorionic hematoma include 1. Recurrent pregnancy loss. 2. Structural abnormalities of the uterus. 3. Pelvic infection, and 4. Patients who have had many previous children. Should I be worried? Will I lose my pregnancy? It can occasionally be associated with increased risk of miscarriages. Subchorionic hematoma, although not considered normal, is not an unusual finding and does not mean immediate pregnancy lost. This is more likely if 1. It is a larger subchorionic hematoma. 2. Older maternal age. 3. Earlier in pregnancy at diagnosis. The location of the bleed is behind the placenta itself, rather than just behind the membranes. This is only relevant later in pregnancy, once the placenta has formed. If the pregnancy continues, there is a small increased risk of some other complications including 1. Early labor or early breaking of the waters around the baby. 2. Placental bleeding and separation from the uterine wall later in pregnancy, also known as placental abruption. 3. Blood pressure-related issues later in the pregnancy. Evidence for these complications is limited. Most pregnancies affected by a subchorionic hematoma progress normally. The subchorionic hematoma resolves on its own, and the pregnancy results in the delivery of a healthy baby with no additional complications. Summarily, the bag of waters within the uterus is composed of 2 layers, called the chorion and the amnion. The inner layer, closer to the baby, is the amnion. The outer layer, which is normally against the uterine wall, is the chorion. The term subchorionic clot or subchorionic hematoma describes a blood clot between the bag of waters and the uterus. How does a subchorionic hematoma look on ultrasound? As an ultrasound tech, we see subchorionic hematomas or suspect subchorionic clots in perhaps 1% of pregnancies in the between 13 and 22 weeks. Most of these occur in women who have had vaginal bleeding. These must be distinguished from regions of non-fusion of the membranes to the wall of the uterus, which are very common prior to 16 weeks gestation. Findings which suggest a bleed or hematoma rather than membrane separation include irregular texture to the material seen beneath the membranes, a speckled rather than uniform appearance to the amniotic fluid. The sensitivity of sonography is low and varies between 2 and 20%, as blood may pass vaginally and not collect in the subchorionic space. Hematomas may also appear isochoic relative to the placenta. Ultrasonography. Acute subchorionic hemorrhages, subchorionic hematomas, vary in ichogenicity and are seen between the chorion and the uterine wall on sonograms. Isochoic hematomas may be missed on initial sonograms, or they may be recognized as heterogeneous and thickened placentas. Color Doppler sonography may help in distinguishing the avascular hematoma from the highly vascular placenta. A subchorionic hematoma can be considered large if it is greater than 50% of the size of the gestation sac. Medium if it is 20 to 50% and small if it is less than 20%. Large hematomas by size, greater than 30 to 50% and volume, greater than 50 ml, worsen the patient's prognosis. Degree of confidence. Ultrasonography lacks high sensitivity for small bleeds. However, it is the most useful modality in a pregnant patient with vaginal bleeding. Uterine fibroids or focal myometrial contractions can cause the placenta to appear thickened, or they may look like subchorionic or retroplacental hematomas. Hematomas are avascular on color Doppler scanning. Fibroids have a characteristic hypoechoic appearance with or without calcifications and typical peripheral blood flow in color Doppler images. Color flow is seen in contracted myometrium, and transient myometrial contractions usually resolve within 30 minutes of scanning. Great learning. Subscribe for more educating contents.